Good afternoon, ladies and gentlemen. Thank you for joining us today at another edition of our weekly Wednesday webinars. Before I begin, just a quick housekeeping announcement. Our speakers will be taking questions for today's session. So if you do have any questions for them, please feel free to submit it via the Q&A button at the bottom of the screen. With that, I shall hand over to our first speaker for today, Ms. Takako Yokochi. Yokochi-san, over to you, please.
Sorry. Okay, thank you, Daphne. So now I'm sharing my screen. Screen looks okay. So I'm gonna start. So hi, everyone. I am Takako Yokochi, Senior Coordinator at Foundation for Biomedical Research and Innovation at Kobe. Today, I'd like to introduce about Kobe Biomedical Innovation Cluster. We call it as KBIC, and our role taking this great opportunity. We will have booths, Kobe booths at Medical Fair Thailand, and we will bring our 5 cluster member companies. 2 of them will introduce their products after my presentation today. By exhibiting at Medical Fair Thailand, we hope that the cluster member companies will expand their business in overseas. And as a foundation, we would like to publicize our activities and making partnering with the international clusters. Our booth number is H14. Please visit us on site. This is a quick summary of KBIC. Now I will explain one by one. As you may know that Kobe area was hit by 6.9 magnitude, a massive earthquake called Great Hanshin Awaji earthquake in 1995. Over 6,000 people died, and the city and its economy were seriously damaged. Kobe City set up KBIC, aiming for the recovery of the economy and to generate employments related to life science from the experience of this tragic earthquake in 1998. KBIC is the first biomedical cluster in Japan, and it is designed to provide a translational research from the basic research to the commercialization. Kobe is in Kansai region. Kansai is in the west part of the mainland Japan, and its population is 90 million. Kobe is one of the government designated cities in Japan, and it is the second largest city in Kansai region with 1.5 million population. KBIC is just 5 kilometers away from downtown Kobe, and there is Kobe Domestic Airport nearby, and Kansai International Airport is also very close. So it's very convenient to get around in Japan, and it has a good balance of convenience and lower living costs compared to Tokyo or Osaka. Kobe Airport will start a service of regular international flights in 2030, so it will become more convenient for visiting from overseas. In order to facilitate the medical innovation, FBRI, the Foundation for Biomedical Research and Innovation at Kobe, has been established, and it has a Biomedical Research Center, Translational Research Center, and Cluster Development Center. There are 3 areas in KBIC: medical area, R&D area, and simulation area. In the cluster, there are 5 medical institutions which provide high-level medicine. FBRI assists cluster members such as companies, research institutions, and universities to collaborate with these institutions for joint clinical research and product development through coordinators. We have several research centers such as RIKEN and FBRI in the cluster. The world-best high-performance supercomputer Fugaku is in the cluster simulation area. It is used for scientific research and used for the analysis of COVID-19 pandemic at the time. Rental labs and offices are available for R&D, new business development, and startups. With these, translational research can be achieved. As of June 2023, KEVIC has 369 cluster members, consisting of companies in the field of medical device, pharmaceutical, and regenerative medicine, universities, R&D support, and other organizations. And it creates over 12,000 employments, 6.9 billion yen, which is roughly $50 million for annual municipal tax revenue in 2020. Recently, we have put in a lot of energy in fostering startups, which are hoped to be a driving force of innovation and cluster development. 76 startups are located in KEVIC for now. We started MedTech Grand Prix Kobe in 2018 to find out promising startups from all over Japan and provided extensive supports, including training programs and assistance for business development, rent subsidy for shared laboratories, and also R&D grants. As another example of supporting startup companies, Kobe City, FBRI, and KEVIC member companies signed a cooperation agreement. With Bayer, we held a networking event in Boston in 2019, and we invited startup companies from Kobe so that they could contact venture capitals or angel investors in the US. Boehringer Ingelheim is a German mega pharma. The only research base in Asia is in KEVIC. And this year we held a joint event for startups as well. We will continue to foster startups and build the ecosystem for it. We are working on the collaborations with leading biomedical clusters in overseas countries in order to help Japanese companies to start their business abroad and inbound as well, and to form the From Global Network. This is the latest global alliance, the MedTech Alliance MAGIA, which is a European alliance with 4 countries, and FBRI signed up for collaboration. Through the system and activities as KEVIC, we could make several achievements. These are good examples. The left one is the world's first iPS cell-based transplant surgery conducted in KEVIC in 2014. The upper right is a Japan-made surgical support robot produced by KEVIC member company, Medicaloid Corporation, and now it has regulatory approvals in Japan. The right bottom is a pulp generative treatment that is a novel technology from Iris Bio. So this was a quick presentation of KEVIC, Kobe Biomedical Innovation Cluster. We continue to work hard to promote medical innovation for the future. We keep looking for international cluster partnership for the support for the cluster members and for the exchange of the latest research studies worldwide. Thank you for joining the webinar, and we look forward to seeing you in Bangkok. Thank you.
Thank you, Yokochi-san. Yeah, now we shall hand over to our second speaker, Sudeepta from Sky Limited. Sudeepta, over to you.
Yeah. Can you see? Let me see my screen. So, hello. This is Sudeepta from Sky Limited Japan. I am an international representative of Sky Limited Japan in Kobe. So today I am representing from Cardiobook from Sky Limited. So our main motto is building a society with taste and state-of-the-art ECG anytime, anywhere, and anyone. And first of all, our Holter, we are presenting a Holter medical ECG device, which is very light, within 25 gram, and also 25 gram, and also this is very IPC water resistance with IP6 certified. And so our so our cardiobook device is like patients can install themselves, and also the data will be transferred bypassed through the cell phone to the cloud, our company's cloud server, and then it will be transferred to the personal doctor or family member, as well as whoever want to check from the recommendation from the patients. And also our Sky Limited also analyze the data. The data will come out with within 5 days, maximum 5 days, but existing Holter device take around 1 to 2 weeks to send the data. So it can be patients can be cured very fast with that data, and installation is very simple. Just attach the electrode with the cardiobook, and just attach the NASA video on the chest and install the application in the cell phone. Then it can detect the data. So this is approved by IPX6, and the cradle, the main device is need to be recharged, and because it is wireless, and also the data will be transferred when the charge is going on into the server. Also, so if when the install on the chest, maybe sometime it's occurred the error, so the data will be recorded into the device. When the charges is going on, it will transfer the data automatically. So this is a sample of report. Right now it's showing the English, Japanese only, but we have also different version language. And also the flow general is like normal general electrocardiographic examination is quite difficult. It can install, it's need to be installed a lot of pod on the chest, on other body. So our Holter ECG device is very small, and also don't need any medical expertise to install. So it's, and also take data from the heart is very accuracy is very good. So it's quite different from the normal Holter ECG device. This is an example of the Holter ECG. So, and our device and normal Holter devices need to be installed in 24 hours, but our devices take 48 hours continue data, take data and transfer to our server, and also patients can be seen, and doctor and can be check the device. So, and this is a cardiographic for comparison. Non-normal, that electrode price is here is $1.2 around, and also very light, so its patients can be applicable, and also take data from the for 48 hours in recording cloud server as well. So ECG, so Right, this is a sample schedule for the recharging the device, because our device is wireless and need to be charged. So it's run 60 maximum 68 hours and need to be charged for 3-4 hours. Then install patient themselves and charge again. So this is an event, and also can be checked event event record as well. So this is when some it can be additional. It can be used for additional option for the medical examination and some brain check purpose, and also it can do stress check. So this is the collaboration of the these universities are collaborated with to the research with our device. And also clinical department also got some test. We did test with the medical department. And this is for the cardiobook stress check. When the stress check is going on, maybe when someone sleeping, it's also check the data from the heart and also can analyze the stress. So our device can do stress map as well. So for an example, if some office in one department has less stress, but some departments has higher stress, so the device can check the higher stress area zone and make a stress map, and we can it is quite good for good working culture and reduce the stress. And all our device is very simple. So all you have to do the install the device and also application in your cell phone. Just it will do everything on automatically. Take data from the heart and send to the cloud server. And also it's need to be charged after 48 hours of running. So as a summary, our device doesn't have any wear, so it reduces the burden and easy to patient and very light. Also support regarding electrode and doesn't need to be installed by the medical staff, so patients can be do by themselves. And monitor alternatively 24 hours monitoring from real time from the telemonitoring or as well from the distance. And also the analysis speed is very fast. Thank you for today's thank you for watching our today's department very much.
Thank you, Sudeepta. So Sudeepta and Sky Limited will be exhibiting with KBIC at H14 at Medical Fair Thailand as well. So if you would like to find out more or you have more questions, you could also see them there at the show. So now we'll move on to our third speaker for today. But unfortunately, they are unable to join us live. So they have sent us their presentation, which I will now play and also go through on their behalf. We are SkyJet Medical from Kobe, Japan. We're so grateful for this opportunity to introduce our products to you. Our company designs, manufactures, and sells 3D monitor solutions for Da Vinci intuitive, minimally invasive surgery robot. Our company has been providing them to more than 300 public and private hospitals domestically and continuously strive to provide our best solutions to our customers. Today, we present a little bit about our company's main products. Medical advancements have been brought about by various factors on a daily basis. Based on fundamental and clinical research, new medical technologies and treatment methods are being developed. Furthermore, with the evolution of technology, imaging diagnostics and surgical assistance robots have been created, enabling more accurate and efficient patient treatment and diagnosis. SkyJet Medical incorporates the latest technology into healthcare, contributing to the progress of medicine. In the first part of today's presentation, there are 4 major products: 3D monitor solution for surgical robot, Apollo 21 remote support solution, comprehensive operating room imaging solution, and imaging solutions for radiographic images. First, we would like to introduce our 3D monitor solution for surgical robot, Da Vinci Intuitive, the most famous minimally invasive surgery robot. Our 3D system is essential for surgical robot for both visual safety and accuracy. Originally, it has been developed and adapted as a semi-standard product through joint research with Kobe University School of Medicine in response to so many requests from medical surgery sites. The 3D composition image of 3D control unit consists of the monitor system, signal control unit, image display unit, and image recording unit. In these parts of 3D signal control unit, it composites both left and right signals from Da Vinci surgical robot into 3D images to output 3D signals line by line to the display, and also output signals to the recording parts by side. It's also possible to connect with other video systems in hospital. In the 3D display image parts, for the assistant doctors and nurses and operating staff in the operating room, the system consists of 2 different sizes of 32 and 55 inches monitors. The weight-lightened 3D glasses reduces burden on the eyes for doctors, nurses, and other medical staff. For the imaging recording unit, we have 2 options for recorders presented by TEAC or Sony upon request. Next, we would introduce the Apollo 21 remote communication support solution. The Apollo 21 remote support solution is a visual and audio live streaming communication tool used usually in the event of conventional online conferences and seminars in hospital. It is now possible for moderators, speakers, and participants to conduct online activities in the style of conventional conferences and seminars. It supports various usages according to each scene, including participation only in the hospital or invited people, including outside of the hospital, teachers, and general citizens registered in this system. According to each scene, visual and audio two-way communications are available between operating room in the hospital, conference rooms, and also remote locations. The annotation function is suitable for remote instructions for surgery that requires accurate directions in real time. The Apollo 21 has very notable specific features: web meeting system for the medical field, available to share multiple images real time without restrictions between medical sites and remote locations. The number of participants and meeting times are limitless. It is also possible to switch out the distributed video from a remote location and control camera installed on-site. Recording of meeting content is available. Visual and audio communications with annotation function and questionnaire survey during the meeting are also available. This is the image of Apollo 21 remote support solution. Two-way visual and audio live streaming communications are available between the operating room in the hospital, conference room, and remote location with a unique annotation and remote audio control system. This is the use of Apollo 21 in hospitals. It is possible to share live surgical images and panorama camera images of hospitals with all conference participants. It is also possible to share images from multiple channels, and there are no restrictions on the number of shared images. The feature of privacy protection allows you to mask on the part of the image content. Conference attendees can use the handwriting feature. On the screen, the nicknames are displayed, making it clear who is handwriting. With the handwriting function, you can freely handwrite, enter characters, and draw shapes such as squares, circles, and triangles. It can also be used in hospitals in combination with video switches, our remote distribution systems, video synthesis systems, and surgical video information systems. It is possible to change the video switching of the video switcher, the display layout of the remote distribution system, and the layout of the video composition system from a remote location. It is also possible to operate a personal computer, such as a hospital's medical record, from remote locations. Recently, StarX has developed Starlink, and it became a hot topic with a low-orbit satellite internet communication system. This is the application image with the link between our Apollo 21 system and Starlink. The better satellite communications are available now live streams of visual and audio distribution and annotation online. We would like to further add some explanation for Starlink by StarX. Starlink is a state-of-the-art internet communication service using low-orbit satellites developed by SpaceX. By placing thousands of small satellites in low orbit on Earth, it has made possible to have high-speed, low-latency internet connections. This system enables us to have high-speed internet connectivity almost everywhere on the planet, improving communication in remote areas and during disasters. Starlink has 4 specific features. Let us take a look at it. First, it provides high-speed internet connections, nearly fiber optic speeds with download speed up to a maximum of 1 gigabyte per second. Second, it uses thousands of satellites placed in low orbit on Earth that achieves low latency suitable for real-time applications. Third, it has a global coverage, enabling high-speed internet connection anywhere in the world. That has made it possible to connect to the internet even in the event of disaster or in the remote areas. Fourth, its flexibility. It can correspond to mobile objects with high-speed internet connections while it's moving on the sea or the sky in a vehicle. Lastly, economy. The installation cost is so much lower than conventional lines, and it can be used on the first day of installation. Next, we will introduce our comprehensive operating room imaging solution. This is the image of our comprehensive operating room imaging solution. Via network in hospital, the operating rooms and various other rooms in the hospital can be connected directly and managed collectively through our video information panel. Once the modality information is inputted in the operating rooms into the central panel, the video information panel would broadcast to the monitors at each separate rooms that can be controlled via touch panels at recipient sites. The central video information panel is equipped with 23.6-inch vertical touch panel for smooth operation. The panel also obtains and displays patient information, and it's possible to control camera, such as to pan, tilt, zoom, focus, in the operating room while checking the preview on the screen. The recording of the operating video and managing layout on the display are also available collectively within one panel at a time. This is the image of video switching terminal in the nurse station, ICU, and medical office. You can select the showing monitors with operating room numbers and videos that you want to see on this panel. The system enables you to manage surgery progress status efficiently and is available to edit and record the high-definition surgery images. Finally, we'd like to present the imaging solution for radiographic images. This is the image of our imaging solution for radiographic images. It is an ideal solution for remote instruction between operating room and remote locations for sharing real-time operating images and audio with annotation. The two-way communication is available, connecting to our video management system through in-hospital video information network. With that, that is all for today. Thank you for listening to our presentation, and we look forward to seeing you at Medical Fair Thailand at booth H14. So that is all from SkyJet. Let us take a look and see if there are questions. Oops. Okay, let us see if there are questions from the audience. All right, I think it might take some time. So while the audience is taking time to post their questions, let me also share with you some information about our upcoming show as well as the webinars. So Medical Fair Thailand will be held from 13 to 15 September in Biotech, Bangkok. So if you have not yet registered for the show, please do so now. You can scan this QR code and be able to register immediately for free. So in addition to the Kobe Pavilion that will be at the show, we have over 800 exhibitors expected this year from 30 countries and 20 national and group pavilions. So we welcome you to join us there and connect with our exhibitors in person. So you'll be able to meet the exhibitors that you have seen today, have deeper discussions with them in person, live at the show. Okay, looks like we don't have any questions for today. So not to worry, if you think of a question only after the webinar, feel free to email them to us and we will connect you to the speaker. We will also have more weekly webinars coming up until 30th of August. So the next one will be next Wednesday, 26th of July. The speaker topics, speaker lineup are all available on our website already. So please take a look and feel free to sign up if any of them interest you. So with that, ladies and gentlemen, a big thank you for joining us today, and to our speakers as well, thank you for your time today. And we look forward to seeing you in Bangkok in September. Thank you and goodbye.